Chemotherapy can affect you both physically and emotionally, so it is normal to feel a range of different emotions during chemotherapy, and these will range from person to person. It is important to remember that you do not need to suffer in silence, so tell your friends and family about your chemotherapy so that they can provide support and be more understanding of your behaviour. Your treatment experience will also affect those close to you, who will naturally be concerned for your well-being. It is likely you will feel unwell after each treatment session, and you may find that you require longer recovery time at the later stages of your treatment course, especially for longer-term plans which last over 6 months. Apart from side effects due to the specific medications you are taking, you may also tire more easily as a result of treatment. Consequently, you will need time to rest and recover, and it may be beneficial to reduce your working hours while you are being treated. So depending on your type of treatment, it is advisable to talk with your employer about arranging some time off work, especially if you are required to attend hospital to receive your treatment, as well as discussing how best to manage your work. Your treatment team will be able to provide further advice and recommendations given your particular circumstances. For example, if you should consider to stop working for a while, reducing your daily hours or the number of days per week, whatever is best for you. This advice will also depend on the type of job and nature of treatment. Be aware that returning to work after a significant time away can also cause anxiety amongst some patients. It is important to consider any insurance policies and other financial implications. Seek help and advice as and when needed, and your team will be able to point you towards where you can get this. Additional resources may be available through local government and social organisations. You might not always be able to do everything you usually do in everyday life. However, you may just find you need to plan ahead a bit more. Your friends and family may be able to help you with some tasks too, so do not be afraid to ask them. You do not need to stop your social life completely. Again, you just need to try to plan in advance. For example, get some rest during the day if you're going out at night. This should mean you'll have more energy for the evening. If you're going out for a meal, you can take some anti-sickness tablets before you leave if you think you will need them. Your doctor, pharmacist or nurse can advise. If you have an important social event, such as a wedding coming up, check with your doctor to see whether they can arrange your schedule so that you're in between treatments that week. The team who are treating you will give you contact telephone numbers for the unit if you have any queries about your treatment. However, support goes beyond your immediate treatment as well. Your centre may offer a range of support programmes for a variety of needs. For example, art classes, dietary and nutrition advice, speech and language therapy, and Look Good, Feel Better workshops. Specialist support centres can provide free practical, emotional and social support. Your doctors and nurses will also provide details and advice on where to get additional support.